Hello, I'm Caroline Page. I'm the County Councillor for Woodbridge. I'm also the Lib Dem Green and Independent spokesperson on County for adult care. I'm sorry I can't be with you at the march. I'm afraid I'm quarantining, but I've got quite a lot to say, and I'm about to say it. I don't know really where to start. Clapping. How about starting with clapping? We were all very keen to clap for the NHS on Thursday evenings during lockdown. Claps come cheap, don't they? And now that we have to wear masks, we find masks rather hard work and unpleasant to wear. So we discover we were clapping for people who were working in conditions we didn't like ourselves. And that's before we look at the horrible responsibilities we were asking them to undertake on our behalves. A responsibility that consumed the lives, caused the deaths of more than 600 NHS and healthcare workers, as well as causing great damage to both the mental and physical health of thousands more. Because we were clapping for the carers on those Thursday evenings, did we think that counted as paying them? We were clapping for people who were making a difference and putting their lives on the line, and we need to remember that thanks come cheap. Change costs more. Why are we paying literally billions of pounds for outsourcing, for apps that don't work, instead of paying the people who do the work? When we clapped, we didn't make the financial distinction between doctors and nurses, between NHS and care home workers. It's the government who's making that. And the government seems to be making that because it's cheaper for them. Yes, working in the NHS has always been stressful. And the health of the people working in the NHS and in care services was already poor before lockdown. If we don't want to face a hemorrhaging of staff through stress, through exhaustion, they must be rewarded, supported and helped to recover too. 30,000 student nurses volunteered for deployment on the front line. Now, whilst it's great that the uncertainty surrounding their future, the disgraceful uncertainty I might say, has now been resolved, why on earth did the government end their bursaries in the first place, so that they are basically asked to pay to fill key roles? For that matter, why should overseas staff have to pay for NHS treatment in the very hospitals where they are filling key positions? I think we can safely say that at the moment this country is being run by people who don't know the cost of anything and who value nothing. But the specific point I really want to make today, and I want you to ponder it, is that although the NHS workers we're talking about are poorly paid and undervalued, and that although the care home workers are even more poorly paid and probably even more undervalued, there is, right at the bottom of the pile, maybe 9 million unpaid family carers on whose shoulders the entire capacity of the NHS and social care system is based. And who claps for them? Oh, of course we mean you too. I've been told that. But the people who were clapping, they were clapping for our carers to get more. So, in the case of unpaid carers, that means more no pay. More no sick leave, let alone sick pay. More no respite, let alone holiday pay. More no recognition. An unpaid carer is ignored by both government and unions alike. It's often only the family and the next door neighbours who see what they do. And I should know, I've been a carer for 20 years now. In hospitals, you are invisible. In a clinic, one medical professional will ask another medical profession, "Is this Mum?" as if you were an oxygen bottle that's attached to the patient. Carers are not a cipher. They are incredibly overqualified for the neglect they're offered. They're responsible for everything. It's just that they're not lauded for absolutely nothing. Nobody ever suggests they need pay, let alone more pay. Carers are offered support like a virtual cup of tea. Yet, where a paid working day may be 8 hours long, maybe 10 hours long, may even be 12 hours long, an unpaid carer's day can be 24 hours. I literally spent 5 solid years sleeping in bursts between my child's almost continual seizures, whilst having to argue her case with the NHS, with social care, with education, all of whom wanted to pass the buck back to the unpaid carer. And like a large number of unpaid carers, this is whilst trying to earn a living. Because you know what? Nobody can live on claps and virtual cups of tea. So, what I want you to take away from this is, yes, we must support the NHS heroes. They are heroes. We must support the social care heroes. They are heroes. But let us take a long, hard look at the elephant in the care room. The other heroes, the unpaid carers, our army of unqualified paramedics, advocates, dietitians, physiotherapists, counsellors, resuscitators, case managers that live lives of quiet desperation right under our very noses, unpaid, unacknowledged, invisible. They too deserve active recognition, active campaigning, and active practical financial support. They too are key workers, without whom the whole system will collapse. Thank you.